Welcome to today's episode of the Silent Struggle, where we explore the hidden mental health crisis affecting university master students. Many students at this level face enormous academic pressure, financial struggles, and family responsibilities, leading to stress, anxiety, and burnout. How does this affect their education? What impact does it have on universities? And most importantly, how can we create realistic local solutions? Today, we are joined by a university counselor, Dr. Salma, and a master's student from the Aga Khan University, Mr. Duncan, who will share their perspectives and a powerful social action that can help improve mental well-being for students. Let's dive in. Why is mental health sensitive issue for master's students? Dr. Salima.
My name is Dr. Salman. Female location women talent is a sensitive now for master students. It's because of interconnected factors. First, we should know that students who are graduates, it doesn't mean they are not struggling just because they have graduate or they are struggling both personally and academically. And because of these interconnected factors like multiple pressure, they are facing multiple pressure from assignments they are given, but also from work, because we know they are working, but also from the family responsibilities. They have families too, but also they struggle financially because they are depending on the one salary to pay for the fees, pay for the accommodation, but also to look out after their families. So they are struggling with financial issues. But the problem is that students are fear to speak out. They are fear to be judged. They don't speak out. But let me tell you that mental health problem can reduce your concentration in the classroom. And you might feel less motivated if you are stressed or you are undergoing depression. So it is very important for you to have a good mental health so that you can succeed academically.
Thank you, Dr. Salima. Can we get some insights for Mr. Duncan on the state of mental health, why it's sensitive, especially for the master students from the Aga Khan University, Dar es Salaam? Welcome.
Thank you, Mr. Care and Doctor. As students of Master's University, we really pass a lot, especially in balancing our studies, the family responsibilities, and the financial constraints that we have. Then you find that universities also lack social support groups to provide support for these struggling students who are the majority. And then on our parts as students, we are also worried to speak out our issues because of how people can perceive us. For instance, some can perceive us as weak or lazy, and therefore we just choose to keep quiet and isolate. Thank you.
Yeah, thank you. What you want to really on the negative impacts of mental health on learning and university goals. Mr. Duncan, how does poor mental health affect students in this regard?
Thank you. As students, we are affected in many ways when we are not mentally okay to focus on our studies. For instance, we have a difficulty to focus on our studies due to stress and anxiety, leading to poor performance. Some of us can decide to quit and drop out of the school or the program due to the overwhelming stressful issues. Some of us develop health problems such as fatigue and insomnia associated with the stress. And even our family and friends, we don't give them good time due to the stress and the issues we are passing through.
Back to Dr. Salima. How does negative, or rather, how does mental health impact negatively, especially to universities?
Okay, to university, they might find the university even more because of student culture. Because if students are stressed, the stress and depressed, it is openly that they are going to drop out of the classrooms. But also it can lead to more crisis intervention because of cases of depression. A lot of cases of depressions will need the university to intervene. And this might also affect not only university, but the whole nation, because it really weaken the workforce development within the country because of fewer graduates that we produce.
Okay, thank you for those insights, Dr. Salima. Now, want to look at what are some of the solutions, the actionable remedies that universities and students can do to fix this, Dr. Sam.
Use the care. For university, first thing that we can do is to raise awareness. We have to raise awareness to the people or the importance of good mental health, like to have workshops and seminars about mental health and self-care. People need to be aware that your mental health comes first before anything else. But also we can develop counseling studies from the universities. For example, we can have counseling units where it is affordable or maybe free for students and even staff to come and look for help. People will know that there's someone who's listening to you, so they'll be able to speak up. But then we can have flexible learning options like online classes or that time programs that will help the student to balance between the academic and their personal life. And we need to support them financially. For example, we provide scholarship or financial assistance so that we can remove the burden of financial struggles. And for students, they need to have what in the mental management skill. They need to learn how to prioritize their tasks, which tasks is not important. But then they need to connect with a fellow student for emotional support. They need peer support more. They need to talk to each other. And you also need to take care of yourself. You need to do exercise, healthy eating habits, but also proper rest for you to have a good mental health. And I can tell the students to seek help. Seek help early. Don't wait until the field gets gotten worse. Thank you.
Thank you very much, Dr. Salma, for those wonderful insights. We have discussed solutions, but let's talk about a low-cost, effective social action initiative that students and counselors can start. What can be done, Dr. San?
Okay. Academic institutions, so educational institutions, particularly universities, we can establish student support circle. So what is a student support circle? It is a peer system of support where students meet weekly to discuss their struggles, academic struggles, and mental health problems and solutions. So you ask yourself how it works. It works, and it's led by trained student development counselors. You need to have someone who can guide that group. And so it can be done in a relaxed environment. Maybe we can just create a safe space outside the classroom for people to have conversations. And we're going to focus on problem solving and stress management. Within that group, students are going to share experiences, they're going to change advice and receive professional guidance. And it should be completely free and inclusive. All students should participate on it. It is open to all master students.
Thank you. Thank you. I love this idea because as students, we just need a space to talk, a safe place we can talk and air our issues. And AKU, for instance, is having a very is having a functional counseling office. We can use that because it is there to mobilize students, create sense to them, so that they join this program, and then we as students, we can ourselves find solutions to the mental issues that we face. Thank you.
Yeah, it's like research show that peer support groups improve mental health by reducing the feeling of isolation and stress. University can support this they don't need to spend much, they can support this by providing a quiet waiting room, and they can encourage students to join on that group. Back to you, Rita. Okay.
Thank you very much, Dr. Salma and Mr. Duncan, for those insights as far as mental health is concerned. Today, we have explored the mental health crisis affecting the master's students at the Aga Khan University. We have seen how academic stress, financial struggles, and family responsibilities can impact the learning outcomes and university success. But we have also highlighted practical solutions and a powerful social action: student support circles that can help students feel less alone and more supported. Mental health is not a luxury, it is a necessity. Universities, students, and policymakers must take action. The first step: start the conversation. Let's break the silence and make mental well-being a priority. I leave you with this to ponder. Will you join or start a student sample cycle? How else can universities improve student mental health? Let's continue this conversation. Thank you for tuning in to the Silence Channel. Stay strong, stay connected, and prioritize your mental health. Until next time.